So the next injury I would like to talk to you about today that's not seen that often, and then when it is seen, it's very complicated, very difficult sometimes to prove in court, is something called CRPS. It stands for Complex Regional Pain Syndrome. In all of my practice, I've probably seen less than 10 of these cases. They're very rare. And the reason they're very rare is the mechanism of injury is not always that common. It usually requires a direct trauma to a nerve itself, usually in the extremities, the arms or the legs. And you're asking, well, what is this? It's part of its name is pain syndrome. And it is probably the most disabling kind of injury you will see outside of a brain injury or paralysis. What happens is a person oftentimes will get an open injury or a laceration or a fracture, oftentimes in the legs, arms, feet, and apparently a nerve has been injured as a result, not readily apparent. Over a few course of months, you'll see very bizarre symptoms. So let's say it's my right leg. My right leg will start to become colder than the left. The toenails on my right foot will take on a different texture and color. And then most severely, you'll have shooting, shocking pain in that extremity that really comes and goes, that's worse some days and better some days for no real reason at all. And doctors have still not really fully understood what this is, how to treat it. There's a lot of different theories. What we see is the quicker you can diagnose it and get it to the bottom of it, you will have a better outcome. And many times it involves pain management procedures. It can involve the installation of a spinal cord stimulator in an effort to block the nerve and alleviate the pain. And the big deal here is it's permanent. It usually does not go away. And it can happen to young people. It can happen to old people. We've seen it across all demographics. This, not unlike mild traumatic brain injury, is the kind of injury that if you see this going on, you need to talk to an attorney very soon. You'll find that it's so rare that many of the doctors don't even really aren't looking for this. It's often diagnosed when everything else has been excluded. And by that point, you may be at the point of no return in terms of diagnostic treatment as a way of getting through this. So again, if you or a loved one is dealing with what you think may be CRPS, talk to an attorney immediately. That is a big deal.